Hello, everybody, and thank you for joining the My Pizza Party podcast. My name is Chris,
My name's Misty.
and we're really excited to get this thing up and running. We've been thinking about it for about a year and doing some research, and really only saw that podcasts were aimed from doctors or other PhD level individuals. There's not really anything that covers the rest of the healthcare spectrum.
Yeah, I would agree. We hear the doctor's perspective all the time, but what about the nurses or the MAs or other people who impact our healthcare system?
Yeah, and or you could have like the perception that you have 15 doctors in your room, like certain TV shows, and they do all the work, but you never really see them doing all the work. They just sit around talking to each other.
Total lie. Total lie.
It is a total lie. I think one of the most fun things I ever saw on TV was when all these doctors were actually running a code.
What code?
That's right.
What code?
One's doing the meds, the other one's at the crash cart, one's doing compressions. They all have their long white coats on. There's no blood, there's no urine, there's no vomit. And they're all just going at it, and there's no sweat or anything. And the nurses are at the door just looking with like a blank stare on their
If
face.
there's even a nurse nearby.
No respiratory therapists, no crazy family members running around the room.
The best is when they just wake up all of a sudden.
Oh, I know, especially from the code. They do 1 minute on a code, and then they miraculously wake up like they gave them a round of epi or whatever.
I've been healed.
They have like a come to Jesus meeting. They actually came to Jesus and came back.
You resurrected.
Yes, we resurrected. So, but why did we name the podcast what we named it?
Chris, before we get deep into why we actually chose to name our podcast Forget Your Pizza Party, we always want to start off thanking those serving in the healthcare that feel like their voices are not heard and are being overlooked. People like your EMTs, your medical assistants, your PCNAs, patient service assistants, secretaries, sonographers, respiratory therapists, your environmental services, of course your nurses, food services, and your phlebotomists. I'm sure I forgot somebody in there.
I think we intentionally left out management.
I think so too. But without all of these people, the infrastructure of our healthcare system would just totally collapse.
Yeah, I think with the advent of all this centralized healthcare, back in the day, pretty much the doctors and the nurses ran most of the hospitals. You really didn't have a lot of administrators. Things I perceive ran a lot more smoothly. Healthcare costs were down. But really nowadays, it is a group effort among everybody. And unfortunately, most groups that work within a hospital are overlooked or underappreciated.
All the time. So as far as why we chose Forget Your Pizza Party, as the title of our podcast, imagine working as tirelessly, understaffed, with no breaks or time to actually care for yourself, and you're being thrown order after order, trying to manage what seems to be 5 million tasks at one time, and then all of a sudden, management pops around the corner, smiling and so excited to announce that they are going to throw you a pizza party.
And most of the time, the management is what caused your whole situation in the first place.
Dumpster fire.
Poor staffing, not rerouting patients when your half your floor calls off, or knowing that you're going to have increased patient burden, especially on holidays, and they still understaff.
But hey, let's have a huddle.
Let's have a huddle.
Let's have a huddle and trying to figure this out.
In front of a whiteboard.
But we want you to make the decision, not
Yeah.
management.
I know. I always love how they always throw back at you what you would recommend, even though you tell them you need more staffing.
Just get used to it.
That's right.
Heard that a few times.
Yes, many times. I don't know how it happens in most industries. Other places I've worked, they would throw awesome parties. We'd have like food brought in from places like Chipotle or Brio or Olive Garden.
It's catered food.
Yeah, for your stressed out employees to say, hey, you know what? Thank you. Here's some really great food. Instead of that, we get back of the freezer, 6-month-old. You have no idea if it's even pizza. It could be like the fake cheese with the fake pepperoni.
Or just think back to your grade school days.
I don't know. Some grade school pizza wasn't bad.
True, that is true.
The government pizza wasn't bad, but this is worse. I think it's worse than government cheese.
I think you're right there.
It's like the freezer burned pizza, the one that's been in there for so long, and then that's what they bring up to you. And when they cook it, it's just hard as a rock.
And then to top it off, they can't even serve it to you nicely. It's just sat there. And then there's no utensils, there's no napkins, there's no plates, and better off, there's no time to actually eat it.
Yeah, and they would do this for day shift, and night shift was always overlooked when we worked night shift.
Oh, forget night shift.
And we always got the leftovers, but by then it had re-solidified. And I especially love the brown paper roll for napkin and plate.
Genius.
That was great. Easily disposable, environmentally sound. You just use recycled brown paper that you would have in the hand paper towel dispenser over top of the sink.
Oh, yes, because not only are we trying to cut back on things, but you need to remember not to overuse their budget by using their supplies.
Right. And I always like how excited management was when they would drop this crap off to you.
Yeah, well, they're smiling as they walk away.
Yeah. Have you ever had a manager actually step in and say, you know what, everybody? Here, I'm going to go work the floor for just a minute. Why don't you guys go and eat?
Work the floor?
One at a time. One at a
What's
time.
that?
Here, go take 10 minutes. I'll go answer some call outs, or I'll go take some phone calls. Go take, some time.
No, Chris. The only time they ever showed up was when we were actually coding. And then they would stand back, watch, and then critique every little thing you didn't do.
I never really saw a manager actually get in on a code either.
I have, and it was the worst situation ever.
Yeah.
You want to talk about horrible chest compressions? You could tell this manager had not done it in years.
Would that be the equivalent of the nurse educators coming around and showing you how to do something even though they've never really done it?
Oh, guided imagery. Always.
Oh, that's like Reiki. Here, I'm going to show you.
Yeah, Reiki.
I'm going to wave my hand over the body and it's just going to naturally compress itself.
Yeah, let's de-escalate.
Ooh, I like that one. What about the post-code breakdown?
Oh, yeah.
What did they call it? Debrief, post-code debrief?
Yes, debriefing.
Yes, what could you have done better? And you always were like,
Yeah, because they're always standing back looking and watching at every single thing you do. They're not looking to actually help save that person's life. They're looking at what are you doing to prevent a lawsuit.
oh yeah, it's always cover your ass. Let's get back to the pizza party thing. So sometimes they would bring in cupcakes or a cake. But here's the funny thing was, do you remember at our former employer up in Cleveland? They were all about losing weight and weight management.
Oh,
But
yeah.
that's what
Get those steps in.
that's what the managers brought in was
Junk.
chocolate covered cupcakes, icing like an inch thick.
Like, you're going to develop diabetes.
But we can't have sugared sodas in our soda machines. But you're bringing in candy and you just look at it and you're going to gain like 5 pounds. And they were so happy. They're like, oh, we brought in a tray of a dozen cupcakes and they thought that they were just the best thing ever.
But you better lose that weight or else your insurance premium will go up.
Oh, yeah. You dare not gain weight with some of these larger health enterprises.
So we've kind of talked about why we named all this, but maybe we should give everybody a little bit of a background on our nursing careers.
Sure, go for it.
So I became a nurse back in 2013, so I've been practicing for a little bit over 12.5 years. I did get my bachelor degree.
Ooh, so precise, 12.5 years.
12.5.
That's like an 8-year-old saying I'm 8.5.
I think. All right. Anyways, I started my nursing career on a progressive care unit that was pretty much all cardiac. It was a closed unit at the time, back when nursing was legitimately nursing.
Yeah, and you had a really outstanding manager there too.
Yeah.
Nationally
Hands
recognized.
down the best manager I've ever had.
Yep.
I spent a little bit of time there, probably about a year and a half. And then I kind of seen how things were starting to change when management, just the shift in how they were kind of forcing the unit being closed. I didn't like it. It was time to move on. So I transferred to the coronary care unit, also known as CCU, where I've spent the majority of my career. Not only that was my home base, but I also floated between different ICUs, medical, surgical. I found myself back up on PCU a few times, and then unfortunately our unit ended up being a COVID unit for quite a while to help our ICUs out.
Yeah, it was terrible.
Yeah, that's a whole nother conversation.
Yeah.
But currently I am working now ambulatory in a really nice cardiac office.
Agreed. Yep. So I got my nursing license a little bit before Misty. Before that, I actually worked as a home health aide for a while. We were going through nursing school. I got my LPN around 6 months to maybe 6 months to a year before you did.
Yeah.
I did hospice contract work. I was on the rapid team for various hospice organizations. Last 3 to 5 days of life, I was called in on a contract basis. I worked at the Department of Corrections as a contract LPN, skilled nursing facilities, assisted living facilities. We ended up getting our RN. I took a position at a healthcare organization up in Cleveland. And
Believe it or not, at that time when Chris got his first job where we currently live, there was a hiring freeze.
yeah, which is shocking. I think there was a transition for these hospital systems to get bachelor degree nurses, but that came a little bit later. But in our area, Columbus actually had a hiring freeze at all the major health systems.
Yeah, which actually worked out the best for us because we ended up in a good place.
Yeah, we did. So we moved up to Cleveland. I started on the med surge floor. It was a 60-bed unit and stayed there for most of my RN career. I switched to a different hospital within our system.
You guys were on kind of like the guinea pigs for a lot of things they rolled out.
Yeah, and we'll talk about that in later episodes, but we were an experimental floor. We trialed a whole bunch of new technology, new staff interactions, and improvement models, and they implemented it system-wide for all of their locations
So
around
we
the world.
can thank you for those whiteboards.
No, that was not mine. That was actually my manager, and utilized in the right way. They weren't terrible, but they started, of course, like management always does. They took a good thing and kept adding stuff to it, and that's what inevitably happened. I ended up switching hospitals while I was in my nurse practitioner school and went to a rapid obs unit that had a ortho step down, and I ended up leaving there, got my nurse practitioner, worked for private practice, came back and was privileged at the same hospital that Misty worked at and where I worked at. And I will tell you one of the best things as a husband.
I didn't have to take his orders.
You did, but because she worked in a critical care kind of environment that was managed by a team, I rarely put orders in for her, but there were just a few times, just
More
a
like
few.
a discharge. Hey, I just need that discharge order.
Yep, but still, I had to give her orders, and it was the only time she couldn't argue with me. It was fantastic.
Yeah.
And then we made a family decision. We had been up in Cleveland for, 13 or 14 years at that point. We had kind of gone through the brunt of COVID in our own ways. And so we decided at that point with our family, we would move closer. And Misty took that position at an outpatient cardiac center. I ended up and still currently work at a visiting home medical provider services company. And I've been there for 2 years, and that's where we're at currently.
Yeah. Best move we ever made.
Yep. Got back home all in time to watch all of healthcare change and the consolidations, especially down where we're at now. And it's been a good move. But the pizza parties and or that whole management strategy hasn't changed.
No, sometimes it's just in a different form.
It's like they all went to the same management school.
It's when they have all those coffee clashes that they're sitting around talking about, ooh, who's throwing a pizza party?
Speaking of management, you were an assistant manager for a while.
Drink the Kool-Aid.
So what went on in those coffee clashes? I'm very interested.
They all sat around and talked about how great they were.
Oh my gosh.
Yeah. It was the stupidest thing I've ever witnessed. And they do it all day long.
So it was like one coffee clutch after another.
Yeah, and they bring in the good food. They had like donuts. They had
Also,
bagels.
they had the top tier food. They never got the
Yeah.
cafeteria repurposed food.
You're talking about your CNOs being there, some
Oh.
of your doctors.
Oh,
Yeah.
oh, that's
No, it was
amazing.
the good stuff.
So I've got to ask, was this like a social? You said it was like social.
Absolutely.
So was it like 10 minutes of work and 50 minutes of just talking?
What work? What they literally sat in a circle. Oh, hey, how are you?
Oh,
How's
that's
things going? How are the kids?
so it's like a healthcare kumbaya.
Pretty
mean,
yeah, and then you literally went around the circle applauding yourselves, patting yourself on the back for all the hard work your little peons out there are doing.
You know what? I think we went into the wrong area of medicine.
Absolutely.
I think
Actually, why did we even go into medicine?
because we wanted to help people.
Absolutely.
We wanted to help people.
It was painted as a perfect picture.
It was.
And you were going to make tons of money.
Oh, I
doing
remember
it.
that. I remember that sales pitch from the school. You'll always have a job, which is true. We always have had a job. We don't have to really search for a job.
And I do have to say I love the medicine and I love seeing what can become of certain situations, but it's all of this other stuff that has really made it toxic.
Yep, it's very unfortunate. It's very unfortunate. They took a noble cause and through bureaucracy and ego and whatever other title you want to apply to it will probably be appropriate, and it's just bastardized it into what we have now. But we'll have plenty of episodes to talk about. So would you like to tell the audience about what we're planning in the future?
Yeah, so some of the topics that we really want to dive into is, of course, management, nurse violence. We've got
Nurse violence.
Yes.
That's going to be a big one. We'll probably end up doing multiple episodes on that, either through our own experience or what we pull from the news, because that is probably, besides mental health for medical staff, I would say medical personnel violence from staff on staff or from patients or family
It's one
on
of those
staff.
topics that people don't like to talk about.
Well, and it's hidden. It's one of those things that's very, very statistically underreported.
Yeah.
And it typically happens to your nurses, to your aides, and there is a system in place that allows these healthcare organizations to keep it internal. One, because of reputation, they want to keep it out of the news. And we'll get into that later, but there are lots and lots of incidences where, and people that work in the hospital systems will know this, that there's an internal incident reporting system, and unless it's very egregious, nobody outside of that self-reporting system will ever know about it.
Absolutely. Another topic that we're going to dive into that will take multiple episodes is COVID. That's something that your healthcare workers, your nurses, your aides, everybody who was involved in that haven't really been able to talk about it. And from my experience, being able to talk about it, even though it's very traumatic,
well, and
you
it's
know,
taboo.
needed.
And it's taboo.
Yeah.
You still can get into trouble for talking about it or expressing your views on it, even to this day.
It is what it is, but that we are going to hit into some COVID. Obviously, we want to take interviews.
Yep.
We want to know, how did your interview go?
Hopefully, as this thing progresses and you all get the word out and we're able to get more resources, that we'll be able to start bringing some people in. We're gonna start with
Christopher, I'm talking about the interview process.
that interview process. Oh, so are you talking about what stage of interviews are you talking about? Are you talking about the interviews for nursing schools?
All of it.
We've got some great stories about the interview process for our nursing schools.
Oh, yes, we do.
We of course we can't name names, but oh my God.
Yeah, one very in particular interview. But yeah, so interviews as far as nursing school, your first job interview, questions, kind of what things look like there. We're also going to dive into new hire expectations, the orientation process. Of course, we can't have a nursing podcast without having good old nursing stories about our patients. And then this one's going to be a fun one, Chris. the water station.
The water station. Oh God, the water station. Oh, all the write-ups over the years with the water station.
Yes. And then, of course, any fun nursing topics, such as what you done in a patient's room that you were embarrassed to talk about.
That's right. We've got to keep it kind of low key, I don't want to give away all of our stories right away.
No.
So the other thing that we're going to do for everybody out there that's a nurse, we're going to keep these podcasts to about, 25, 30 minutes.
That sounds good.
Yeah, your drive in, hopefully you'll get something out of it. You can always reach us with any topic, question, or concern at forgetyourpizzaparty@gmail.com. And don't forget to link into our podcast, subscribe, or hit that notification bell depending on where you get your podcast at. You have anything else to add before we rock out of here?
No, thank you for everybody, though, listening. You guys are appreciated. We hear you, we see you, and we love you all.
And truly, this is going to be for everybody out there. This is just our brainchild, but this is for all of you that don't have a voice, that want your voice heard, that this is your outlet just as much as it is for us, because we don't have any other outlet than ourselves and with each other that work in this industry. All right, take care. You all have a blessed day. Stay safe, and we'll see you next time.
Until the next time.